Introducing Musa 3, assisting surgeons to advance microsurgery, designed for precision, built to empower. Musa 3 becomes an extension of your intent. Tremor filtration steadies every move. 4 and 7 times downscaling guarantees pinpoint control for microsurgery. Works seamlessly with all your trusted tools. Endless rotation gives total flexibility. Angled access delivers the range of motion to reach angulated wounds. Musa 3 is ergonomically crafted to keep you comfortable. Flawless and flowing for perfect anastomosis every single time. Transforming lives in LVA, nerve repair, flaps, and replants. From learning to performing, fast. Less than 10 minutes to set it up and ready to use. Musa 3, assisting surgeons to excel. Microsure, robot-assisted microsurgery.
The biggest advantage of a robot for microsurgery is precision. We perform smaller and smaller operations, and our eyes are enhanced by microscopes. And these microscopes are getting better every year. The vessels are getting smaller and smaller, and our human hand has a natural tremor. And this tremor is becoming more and more of a problem if you go very small. So the biggest advantage of the robot is it can filter out the tremor. Second thing is you can be very precise. Robots can be more precise than any human hand by motion scaling. So I can ask the robot to move 1 centimeter while my hand is doing 10. The quality of the surgery goes up because the precision of the surgeon increases. So the anastomosis quality is better, which results in lower complications, better operations, so faster recovery. There was a person who accidentally cut off his thumb in a circular saw injury. The local hospitals couldn't help him, so they transferred the patient to the hospital here in Maastricht, and we replanted the thumb. So what you need to do then is put back the thumb, reconnect the bone, the tendons, the nerves, and the arteries and veins to get the thumb back on the patient, but also working and alive. I think it was about 4.5 hours in total, which is normal for an operation like that, because you need to reconnect all these structures under a microscope. Surgeons are sitting behind microscopes or hanging over a patient in awkward positions sometimes for long hours. So neck problems, back problems are very common. So an extra benefit of a robot would be that a surgeon can sit ergonomically while operating for long hours. In my opinion, surgeons will not be replaced by robots. Robot assistants can democratize microsurgery. A lot of surgeons who are really good surgeons just don't have the precision in their hands, and a robot can enable any surgeon to get the precision. I think the early adopters are getting in now, and I think within a few years a lot of people will start using robots as it is common in other fields, and an operation is always more than the trick itself. There are so many choices you have to make for a specific patient. There's so many situations that need judgment, but it can take a lot of parts of the operation by itself. So at the moment, robots are only exactly doing what the surgeon is doing, copying my movements. I think in the near future, parts of the operation might be done automatically, but the surgeon is always responsible and the surgeon will always be in control. A robot is a tool.
Yeah, so I think, interestingly, we didn't start to have problems physically with microsurgery until luminal diameter, so the size of the vessel or structure, got below about 1 millimeter. Over 1 millimeter, we were mostly able to do that pretty consistently by hands. I think when we get into sub-millimeter structures, it gets more difficult. We start to bump up against the limits of our own physiology. And most of the procedures that involve that are right now in plastic surgery are lymphatic procedures. So lymphovenous bypass was probably the most important one to treat lymphedema of the extremity. We're also learning, though, about new disease conditions for which lymphatic surgery might be applicable, like Alzheimer's. And there's also other areas that are sort of adjacent, but also enjoy the benefits of microsurgical applications, like ophthalmology and small nerve surgery.
Patients could benefit from lymphedema treatment, and how would it help them?
The lymphatic anastomosis, the bypass we perform from lymphatic vessels to a vein, are usually indicated in early stage lymphedema in the extremity, can be in the arm or in the legs. Usually they are after cancer treatment, patient can develop this kind of disease, and then you can help them with this surgery to reduce some of their daily complaints. They can also use less decompression garments if this surgery has effects.
What kind of role can a robot play for this group of patients?
Well, this surgery we usually use with a big magnification under a surgical microscope. And these are structures that has less than 1 millimeter diameter. So they are like a minuscule structures. Even in hands of very experienced microsurgeons, when you have a very bad day, you can have tremor and be less delicate with tissue handling. If we have a robotic platform dedicated to perform microanastomosis, you can be sure that the anastomosis will be performed and you will be able to be gentle without tremor when performing all these stitches with 11 sutures. I think the robot could radically help with this procedure, especially if you don't have much experience in microsurgery. You could also perform this surgery if you have been trained to operate with this robot.
Do you think that the robot could also help for other indications?
There are a lot of possible indications for this robot. Some of them, I think, are beyond our imagination, because till now our indications were all based on how my hands can handle that. We are not going to operate anything beyond our hands' capacity. So once you have this machine that is powerful and gives you much more freedom when you use it, of course, we can think of more indications. In pediatric patients, we can also start to do anastomosis for very small vessels in surgeries. So these are very important and relevant indications that can make a big difference in patients.
How do you think the future looks like?
I think I will be very surprised if I see the future. I guess there will be a much more prominent role of artificial intelligence in all the procedures we are doing. Of course, we still have to use them just as tools, because the last answer has to stay in the surgeon, because we are also ethically responsible of what happens with the patients. But I guess we will have a lot of tools and devices that will help us make the right decision to be more precise in our surgeries, use the robot for some part of the surgeries that will make this surgery more accurate and also faster. I could say that I'm a little bit early adopter, so I'm totally open for technology, and I'm totally sure that technology will also help us, because as human beings, we have our limitations.
Which patients could benefit from lymphedema treatment, and how can they benefit?
When it comes to lymphatic vessel surgery, the patients that would benefit from a surgery would be the ones that have still fluid in the extremity, despite a compression garment, where the compression garment is inconvenient, not practically possible to use maybe for work, or where it's causing too much problem and is not helping enough, preferably early stages of lymphedema.
Do you think that the robot could play a role in the treatment of these patients?
I think that the robot will be playing a role for the treatment of lymphedema patients, in the sense that it is a technically challenging surgery. And when it comes to advancement, we need to make sure that we are constantly improving our surgery. There are different ways to address this, and one is to improve the techniques, and the dexterity and the manual work can be improved by using a robot. Another aspect is the fact that it's normally a very long learning curve to achieve good vessel anastomosis. Using a robot, achieve good results earlier on in your training.
Do you think that in addition to lymphatic surgery, there are also other types of application where the robot could be useful?
I think the robot will be used in different areas outside of lymphedema. Anywhere where you need high precision and delicate structure is being handled, the robot has a role in the future.
How do you think the future will look for robotic microsurgery?
I hope to be able to see what the future looks like, to be part of it. When it comes to robot application in microsurgery, it has many potential areas, but the challenge is to incorporate it with other new techniques and to make it available for a bigger population and more centers. So the challenge is to make it accessible and combining it with other techniques. But if that is being achieved, I think it will be applied to many microsurgical procedures.
And do you have ideas how the robot can be improved or what can be added to the robot in the future?
So I think by adding other technology to the robot, you will be able to address more parts of the challenging procedure as microsurgery is. We're talking about visualizing vessels, detecting the lymphatics, but also the venous earlier on, maybe by implementing feedback loops and directing with technology like AI instructions back to the surgeons or the robot itself on whether you're on a good way or a bad way for achieving good outcome. So I think there are many, many possibilities in the future. Many of them we don't even know about today.
How does the future of microsurgery look?
Well, I think the future of microsurgery will contain enhanced precision by robots and enhanced vision with 3D cameras and augmented reality using AI.
What are the advantages of robotic microsurgery?
The advantages of robotic microsurgery, first of all, is precision. Robots are much more precise than a human hand. Secondly, they're constant. So my human hand can be very precise, but if I'm stressed out, or if I've been operating for a long time, my hand gets a bit shaky, and robots always do the same.
How can patients benefit from robotic surgery?
Patients benefiting from microsurgery is a question that needs to be answered by science. So we need to do proper studies to compare robotic surgery to conventional surgery. But in my expectations, precision will give higher quality operations, faster recovery time, and less problems for the patients.
How do you think the future of robotic microsurgery looks like?
The future of robotic microsurgery, in my opinion, concerns the integration of robotics and enhanced visions with augmented reality and AI learning. So first of all, we will see different structures using techniques and have a sort of navigating. Second thing, what we will see is semi-automated surgery, as I think parts of the surgery can be done automatically.
The future of microsurgery is incredibly bright because there are so many new developments. It's not just microsurgery itself, but a lot of the technology around microsurgery, like better imaging. We can see things preoperatively, we can plan things preoperatively. And then assistance with the surgery, like robots, for example. Like any new technology, when you started, it's not as good as the way you used to do it before. And then all of a sudden, you cross that learning curve and it's fantastic. There are several challenges for microsurgeons, starting with reimbursement. Microsurgery is long and intensive, and it doesn't pay as well as, for example, cosmetic surgery. And it's more stressful. That's a big impediment in terms of recruiting new people who want to do microsurgery. I don't see any other major problems. That's probably the biggest problem. I guess one of the other problems is not just reimbursement, but access to technology. The technology has become very expensive. A new microscope, a robot, whatever you're buying is very expensive. Some institutions are not willing to buy that equipment when they could have other revenue streams that would require less expensive equipment. So that's a challenge for microsurgeons to overcome. The advantage of robotic supermicrosurgery is the elimination of natural tremor. Everybody has a tremor, and particularly as you get older, the tremor gets worse. When you're operating on smaller structures, you need greater magnification, and the greater magnification you use, the more visible the tremor is. And the tremor becomes a problem. If you're trying to place a fine suture in a very small structure under high magnification, you can't do it precisely because your hand is shaking. With a robot, the tremor is gone, and so you can place it exactly where you want it. The second big advantage is ergonomic, because you no longer are standing or sitting with the patient and having to put your arms or body in awkward positions for long periods of time, because you're sitting remotely with a joystick and you can see precisely on the screen what's happening. So it's much better ergonomically as well as visually. I think currently, because robots are new, they're not going to be widely used at first. There's a learning curve with robots, which will be eliminated when new surgeons have been trained on robots. But people like me who've been doing microsurgery for many years will have to learn the technique of using a robot. I notice with my own grandkids, they can do things because they're used to playing video games. They have skills that I don't have. And those are precisely the skills that will be required for robotic supermicrosurgery. I think once microsurgical robots become a commonplace thing, I think they will be advantageous for every type of microsurgery. You can do most current microsurgery without a robot because there isn't a robot. But once the robot becomes available and widely accepted, then I think it'll be advantageous for all sorts of surgery for many reasons. One of the problems with microsurgery is it tends to be a young man's specialty, because most microsurgeons, as they get older, find that it's very stressful and very time-consuming. They notice that their tremor is getting worse and they have less reserve for long surgeries. With The robot, a lot of that problem is gone. It's more comfortable, it's easier to do, it's probably less stressful because you know that your dissection or your anastomosis is going to be more precise. I think ultimately robots will be used for pretty well all microsurgery, because apart from the robot being a development in itself, it's going to create developments within microsurgery. For example, we're going to be able to do more precise dissections and more precise reconstructions because of the benefit of being able to use a robot to safely dissect and suture smaller tissues. I think ultimately the robot is going to be normal part of microsurgical practice. The trends and future developments of robotics and microsurgery beginning to become apparent. And the most obvious one, in my estimation, is the application of robotics to lymphatic surgery. Lymphatic surgery is relatively new and involves operating on smaller structures. That highlights the main advantages of a robot by being able to safely operate on small structures without causing damage because of instruments not being appropriate or because of a tremor causing movement within the field. That's the most obvious initial development of robotic microsurgery. I think as that becomes more apparent, people will realize how useful a robot is and will start applying it in areas that we don't currently use. Because of the advantage of robots, we're going to see development of new areas within microsurgery that we haven't even thought about yet. That's usually the case, a major advance in technology. We saw that with the development of the microscope. Before the microscope, we weren't able to do a lot of operations that are now commonplace. The same will happen with the robot. There are things that we haven't thought about yet that we'll be able to do with a robot. The big advantage for me of the MUSA 3, there are several. One is the fact that the console is remote from the patient. And that allows the surgeon to have a better view without having to contort himself to get that view, as is the case now. Often in current microsurgery, we have to adopt a very uncomfortable position for a long period of time in order to be able to do what we want to do, whether it's dissection or suturing. Because of the freedom of movement and the range of movement of the robot arms, we can access those areas with a robotic arm from a console sitting comfortably. I think that's a big advantage. One of the biggest advantages of the MUSA 3 over some of the other microscopes, which is a very good robot, but the huge advantage of MUSA 3 is the ability to use your existing instruments and to change out instruments. For example, we can use a Westler suture scissors, which is a combination of a needle driver and a scissors that allows you to not only place the suture, but cut the suture. But it also allows you to use different types of instruments. With the development of the robot, the further development will be able to adapt the robot arm holders for different types of instruments and long instruments. What kind of future applications do I envision for the robot? There are several. The most immediate and exciting one currently is the treatment of neurodegenerative disorders. We now recognize that the brain has a lymphatic system, and that lymphatic system drains into the neck, and through the neck drains back into the circulatory system. In certain neurodegenerative diseases like Alzheimer's and Parkinson's disease, we know that there's some abnormality of the lymphatic system that we don't fully recognize. There has been work in China where surgeons have operated on patients with Alzheimer's and Parkinson's disease by doing a lymphaticovenous anastomosis in the neck, in a particular part of the neck where we know the brain lymphatics drain. And if that turns out to be something that works, it's going to be revolutionary, because these diseases are so devastating and so common. It will become in huge demand to have these operations. These operations are doable without the robot, but they're extremely difficult, and probably only a handful of surgeons will be able to do them. And one of the wonderful things about the robot is that it not only facilitates doing difficult anastomosis more safely, but it probably expands the scope of the average microsurgeon. Not every microsurgeon can do a tiny anastomosis flawlessly for many reasons. But with the aid of better magnification and with the aid of a robot, probably a greater number of microsurgeons will be able to do more complex procedures that they can't do now. So I think that's going to be a huge development. And I think there are other developments that we don't even understand yet. A lot of them relate to the lymphatic system. We know that a lot of the diseases that we know now, like ulcerative colitis and Crohn's disease, may be related to abnormalities of the lymphatic system. What hasn't been figured out is how to treat those, but it may be that a surgical option is one of them. As with some of the other lymphatic disorders that we've seen, reconnecting the lymphatic system to the venous system may be part of that answer. And again, the same will apply to those solutions as applies to the neurodegenerative disorders. So I think it's extremely exciting future.
Microsure, robot-assisted microsurgery.